this is a real and raw discussion of the challenges of home care and home health. It's not an all-inclusive list. This is just my personal opinions and thoughts that I jotted down on paper. And there are a lot of amazing things about home health and home care, so that's for another coffee chat another day. If you are interested in getting into the industry as a provider, if you're considering home care or home health for mom and dad, or if you are a professional that likes to optimize processes, then this is a great coffee chat for you. So grab your coffee, cheers. I promise there's just coffee in here, and we'll jump right into it. 1, it's a 24/7 business. Not, I feel like I'm working 24 hours a day, 7 days a week, but actually someone is working 24 hours a day, 7 days a week. 2, we can't optimize one-on-one care. We can't work short-staffed. So when a client needs an individual in their home, that individual needs to be there, and they can't take care of multiple other clients at the same time. And if that caregiver is unable to attend, we still have to get someone there. So we can't optimize that one-on-one care. 3, scheduling. So this is the most dynamic part of home care and home health, is actually the scheduling services. So we're going to spend a little time here. You can skip ahead if you want. 1, our staff can only work 40 hours a week, or they have to be paid overtime. 2, much of our staff has limited availability and they set it. 3, clients want the same staff, but those staff have limited availability. 4, clients speak with staff directly, and then the staff member maybe doesn't want to do that, so they tell us about it, and then the office will call and speak to the client, and then the client thinks that it's the office not giving them what they want, not the caregiver. So there's this interesting dynamic that we have of, we want to protect the caregiver and empower them to have those conversations, but if they don't feel comfortable with it, we want to, and then it can look rough from a customer service perspective. So that managing that dynamic is interesting. Next one, people get comfortable, which is great and normal and wonderful that you get comfortable with your caregivers. So the downside here is that this is the caregiver's job, and so that caregiver is sick or needs to go on vacation because it's their job and they need a break, and we need to fill that role with an equally competent individual. So the challenge arises not because we don't have equally competent people, but because clients don't like change, and so then they don't want care when their primary caregiver is away. And so one of the things that we really try and push is that we're all strangers at the beginning, and this is why you hire a company, is because we have these equally competent people that can make sure that you always get the care that you need. And we know that change is sometimes not ideal, and there is a time and a place for everything, but we really encourage people to accept, you know, that new person, to embrace that opportunity to meet someone new that can give a great care experience as well. And the last aspect of that scheduling piece is personality. Every team member has a different personality, every client has a different personality, every family member has a different personality. And when we're in a home 1 hour a week, it's easy. When we're in the home 24 hours a day, now you have a minimum of 7 team members coming in, plus all these additional dynamics. Sometimes clients can feel like we're only half good because they like these 4 better than these 3. So that personality aspect is a scheduling and a customer service challenge for sure. So number 4, we can't control the home environment. So you could be a hoarder, great, but we can't, that can pose a challenge sometimes for individuals coming into the home. So we can't control that home environment, and that can make it very difficult. 5, we don't get to see our direct care workers. So at a facility or a hospital, a supervisor or a manager or even a peer would get to see a team member at every visit, and we don't get to do that. So even though we have extensive protocols in place for supervisory visits and buddy visits, which are like preceptor visits, we still aren't going to have that level of insight, and so we need constant feedback to know where we can improve and where our team members can improve, and that's a challenge. And then 6, people are people. Our team members don't like conflict. They get comfortable with clients. They don't want to say no, then they feel guilted into doing something. And then over here you have our clients who want complete access to everyone, unlimited hours, and feel like the office doesn't understand. And then we have employees don't want to go into an environment that's dirty. They can't go to the bathroom safely. And our clients, they expect us to show up no matter what. So people are the most incredible part of our business, and it's also for sure the most challenging aspect, is figuring out all those dynamics. And 7, then you put on top of all of these challenges that we are a highly regulated industry. We have hundreds of pages in our policy and procedure manual that have to be reviewed, updated, adjusted, and adhered to. So what we're asking for at Silver Lining is that you give us the benefit of the doubt, that you know we are working hard for that customer service experience. Assume the best. We have no missed visits, because when we have a short notice call out, we always get someone there. We pay that caregiver or team member extra, and we don't pass that along to the client. We have low late visits because we have our reliability pledge and we incentivize our people to be on time. We have high response times because we invest in the technology and the people to make sure that we can do that. But we haven't fixed these 7 challenges. So it's gonna be really, really cool to see where technology and people take us over the next couple of years, what we're gonna see as it comes to keeping people happy at home and safe at home. And if you have any brilliant ideas or wanna drop us a line, just email us at SLHCI, Silver Lining Healthcare Institute, SLHCI @silverlininghealthcare.com. Enjoy your coffee.